Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide an update on COVID-19 for the week of November 26th. As in the past couple of weeks, I'll talk briefly about the continued growth and spread of the pandemic, the changing patterns of death in Europe, and this is becoming quite important, cases, hospitalizations, and deaths in the United States, and the status of the pandemic in our region. Obviously, cases around the world continue to grow. This is a history of deaths, almost 1.5 million deaths worldwide, 61 million cases. And in the past week, the number of deaths has increased by 5%. As you recall, I like to follow the week-to-week growth rate because this tells me whether the epidemic is speeding up or slowing down. At a 1% growth rate, you can see there's very little growth. At a 5% weekly growth rate, the number of whatever you're looking at will double in about 15 weeks. And at 10%, it'll double at about 7.5 weeks. So at a 5% growth rate, we're going to expect the total number of deaths to double in about 15 weeks. This week-to-week growth rate has dropped quickly in the beginning and then has sort of leveled off worldwide. In the past couple of weeks, you can see that after several months of 3.5% growth rate, it's now increased. This is a worrisome trend because this tells you that the number of deaths is, again, starting to speed up. If the 5% week-to-week growth rate continues, we'll expect to get to 2 million deaths in about 7 weeks. These are the 20 most impacted countries in the world as of November 26th. As always, we color code them. White is Europe, red is South America, blue is North America, and now increasingly yellow is other places. But what I want to show you is where we were 6 months ago. And what you can see is in every case, the number of deaths per million has increased significantly, in some cases dramatically. And what you can see is in May, there were several parts of the world, particularly South America, which were just beginning to be hit. And this is an important take-home lesson because a lot of times people say, well, what about this country? What about that country? What about this state? And you always say, just wait. And let's see what happens, because over time, it looks like almost everywhere is going to get hit. This is a chart from the WHO. It shows that early in the pandemic, the deaths were occurring in China. Well, we knew that. Then by April and May, they were occurring in Europe. By the middle of the summer, increasingly in the Americas, but now going back to seeing them occur in Europe. And this brings us to the second issue of the day, and that's the changing pattern of deaths in Europe. You'll recall that we followed this pattern early on in March and April. The number of deaths, in this case in Belgium, rose very, very quickly. And then it seemed to have leveled off. And then in the last couple of weeks, it's increased again. And so we follow the week-to-week growth rate. After months of being less than 1%, the last couple of weeks it hit 10%. Now it's down a little bit and 6.5%. But this is what I want you to really pay attention to. What you can see here is that in March and April, there was a spike in daily deaths in Belgium. And then it came down and there were very, very few deaths, maybe a tiny spike there in early August. And then you can see a second spike. So almost 7 months have elapsed between these two spikes. Fortunately, we are seeing it start to come down in Belgium. The other thing that's interesting is that it's about 2/3 as high as the previous spike. Now, is this because of improvements in healthcare or changes in the virus or something else? We don't know for sure. What we do know is that we're seeing the same pattern in the 4 most impacted countries in Europe: high, quick growth, leveling off, and now growing again. We're not quite seeing the same pattern in deaths, so it looks like it's certainly in Italy we're seeing it. In France we saw it. United Kingdom, somewhere 6 to 7 months after the first spike, they saw a second spike. We don't know exactly what this represents. It could be that they're just simply opening up. They locked down so well that those folks that are now getting sick and dying were not exposed before. Or it could be a mutation or a new wave. We don't know. But what is important is that we continue to follow it. It's certainly good news to see that the second spike in Belgium has reached a peak, at least for the moment, but we definitely need to keep an eye on it. In terms of the states, we're following cases, hospitalizations, and deaths. Cases happen first, then a smaller number of hospitalizations and a smaller number of deaths. This is the expected sequence. Cases increase. A couple of weeks later, hospitalizations increase. A couple of weeks later, deaths increase. In terms of cases, this is where all the cases had been in the United States as of August 13th, again, clustered in the Northeast, big cities, and in the Southeast. But then in the last 2 weeks, you can see it's just hammering the entire middle part of the country. In fact, there's very few places outside the Northeast and the Southeast and the far West that aren't being hammered. This is a time lapse. There have been 13 million cases in the U.S. so far. This is a time lapse we created from July to November. So the last 4 months. When I put it into motion, the darker cases in the last 2 weeks. In the first couple of months, not much was going on. We saw this explosion in Alabama, then all of a sudden the Dakotas and Wisconsin, and then it kept spreading and spreading and spreading. And so now virtually everywhere outside the extreme limits of the U.S. is being hit pretty heavily. In terms of cases, you can see there was a spike in March, a bigger spike in July, and a bigger spike in the last couple of weeks. I'm not a big fan of using cases because it depends on how much testing you do. So I like to look at hospitalizations or deaths. In terms of cumulative hospitalizations, this shows you that the number keeps going up. It's not particularly helpful. But if you look at the week-to-week percentage increase, what you can see is in the past couple of months, we are seeing an increase in the week-to-week growth of hospitalizations. This is worrisome. It tells me that the pandemic is still growing around our country, which we know from the cases. We also see it in hospitalizations and deaths. Again, 269,000 deaths in the U.S. alone, over 250,000 deaths. Last week, the week-to-week growth rate was 4.2%. And again, if you look at the last couple of weeks, from early September to now, you can see this increase in the week-to-week growth rate in deaths, telling us that not only is the pandemic still here, it isn't slowing down, and over the course of the entire country, it is growing. At 4.2%, the total number of deaths in the United States will hit 300,000 in about 3 weeks before the end of the year, and it will hit 400,000 deaths around February and probably hit 500,000 sometime in March if we don't do something about it. What we're not seeing yet in the United States is this uptick in those most heavily impacted states. You can see New Jersey, New York, Massachusetts, and Connecticut all sort of look like those European countries, a quick increase and then leveling off. Massachusetts had a slightly different pattern, but maybe with the exception of Connecticut and maybe New Jersey, we're not really seeing that recent uptick. So we'll have to wait and see whether we're going to see that or not. For the moment, we have to think of this as a national pandemic. It is hitting everywhere at once, including our region. If you look at Tennessee's had 4,500 cases. Virginia's had 4,000 cases. Our regions had 648. We're now using the ballot health catchment area because that's something all of us are familiar with, 688 deaths. Virginia keeps popping around 3 to 5%. You will recall for a long time they had more deaths than Tennessee, but Tennessee has passed them and continues to grow. This is where all the cases were in Virginia as of August 13th, and this is where they are in the last 2 weeks. And again, now hitting much of the state, including but continuing to be particularly impactful in the rural areas. Tennessee continues to be growing week to week, really quite worrisome. This is a very, very high growth rate, and it continues. It hasn't been below 5% for a long time, and it appears that over the last 2 months, the week-to-week cumulative growth rate continues to go up. This is where all the cases were in Tennessee as of August 13th, and here's where they are in the past 2 weeks, just everywhere in the state. If we look at hospitalizations in Tennessee, by the way, Virginia doesn't report COVID hospitalizations. What you can see is, again, an increase in the past couple of weeks. This is really worrisome. I had hoped that at some point we would be cresting and leveling off. We just don't seem to be there. Now, hopefully, this pattern will reverse itself soon, but it isn't reversing right now. And if you combine Northeast Tennessee and Southwest Virginia, you can see that we're in the midst of one of the most heavily impacted areas. In terms of the ballot catchment area, this is the cumulative number of deaths since August, and you can see continued growth. In terms of week-to-week growth rate, about where Tennessee is, in fact, slightly worse. At a 9.3% week-to-week growth rate, the total number of deaths in our region will hit 1,000 in less than 5 weeks before the end of the year, and will double in about 8 weeks. So the bottom line is globally, COVID is still spreading widely, and it appears that the week-to-week growth rate has increased. This is worrisome. It tells us that this pandemic is not going away. There appears to be a significant and growing resurgence in deaths in the most heavily impacted European countries. It's not quite clear what the cause of it is. It appears that at least some of the countries, this resurgence has hit a peak, which is good news. The US is now 7th in the world for deaths per million. With increases around the country, we account for about 1/5 of the total number of cases in the world and total number of deaths. We have seen an increase in the week-to-week growth rate in cases, hospitalizations, and deaths over the past several months. Again, this says that whatever we're doing isn't working. We're not controlling the pandemic, and our region continues to be heavily impacted as we expect a doubling of deaths by mid-January. And while there are several vaccines showing promise, none are yet available. We cannot rely on a vaccine to turn this around in the short term. So in the short term, we need to keep doing the things that we know work. And perhaps the one that doesn't get talked about enough is avoid unnecessary crowds. Stay away from people if you don't have to be near them. Yes, masks do work, and I'll leave it at that. Remember, social distance is both distance and time. Stay as far away from people as you can and be near them for the least amount of time possible. Good hygiene, as always, helps reduce respiratory illnesses. Please stay home if you're sick. We need to be much more aggressive in testing. I think the biggest breakthrough short of a vaccine will be a rapid, inexpensive test that we could ideally do at home to know whether we've been exposed. Pay close attention to quarantine and isolation, protect the elderly and those with chronic conditions, and keep following the data and allow our actions and thoughts to change as new information is available. I'm constantly looking at this pandemic and revising what I think and what I thought. Please be open-minded. I don't care what your politics are. I don't care how you got to the point you are today. Allow the data to drive your thinking. If we all do that, we can disagree on nuances, absolutely. But if the data tell us something, let's do the best we can to abide by those data. And we have to rebuild our trust in our regulatory and public health agencies. There's a lot more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let Jan Stork know. She can be reached at her email or telephone number. As always, I'd like to thank Melissa White for updating many of these slides and for Dara Young for editing, producing, and posting this video. If you have any questions, comments, concerns, criticisms, please let me know. I answer a number of emails offline every week, and I'm happy to do that if I can. So please let me know if there's anything that I say or anything that you hear or read elsewhere that doesn't make sense to you. As always, thank you very much for taking the time to watch this video. And please let me know if I can help in any way. Thank you very much.